Hi, I'm your host, Marsha Florence for Just Ask Talk Show. Today's show, ladies and gentlemen, is Residential Hospice. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Residential Hospice. And we have with us today Stephanie Rose, Regional Sales Director, and Cherylann VanSickle, Hospice Director of Clinical Services. Good afternoon, ladies.
Good afternoon.
Good afternoon.
Thank you for joining us.
Thank you for having us.
Right. Now, let me say this. A lot of people have questions and concerns about hospice care. Some of us don't know or don't understand it. So today I'm asking you both to take a moment out of your busy schedules to give us some insight on what is hospice care and palliative. So let me start off with you, Stephanie. I know you're the sales director. You know pretty much about what's going on here. Tell us a little bit about yourself and your role.
I've been in hospice care for 15 years now. I work out of our Troy location. We have several locations in the Michigan area and also in other states. And I've been in the Detroit territory for 15 years now with hospice care.
Okay. And Cherylann?
So I've been with residential hospice as a clinical director a little over 3 years. I started my career 15 years ago. This is my second career and got into, right out of nursing school, got into hospice. And it's been my calling, and I've worked different aspects of hospice, from being a case manager, admission nurse, got into management, and now as a director. So really, it's our passion.
Okay. Now, the main question I'm going to start off with is, what is hospice?
Well, hospice care is a patient that's been diagnosed with a terminal illness. They have a life expectancy of 0 to 6 months, and they no longer want to seek treatment. You know, they just want to be kept comfortable. They want their symptoms and pain being managed. So in a nutshell, it's a person that has a terminal diagnosis that wants to be kept comfortable and no longer wants treatment.
Okay. So what is palliative care?
And I think people so often get palliative care and hospice confused. So with palliative care, you don't have to have the 0 to 6 month terminal diagnosis. And it's for a patient that has an illness and they just still want their symptoms to be treated. You know, so it can be, an example could be a cancer patient that still wants to do chemotherapy or radiation treatment. With palliative care, it'll be a nurse practitioner that will be involved as far as your symptom and, managing your symptoms.
Okay. So a lot of time when people are going through something such as a health crisis, you may hear the doctor say, we're going to go ahead and sign you up for hospice. Is that something that's normal between a patient and the doctor, or how does one know that they think or know that this is that time?
Well, a lot of times when they've exhausted, all treatment options and they're not improving health-wise, it can be a patient that, keeps going back and forth to the hospital, and every time they go out, they've done everything they can do, and they've kind of exhausted all of their, resources as far as treatment, and the patient is just not improving health-wise. So at that point, they may consider hospice, and, many times doctors and hospitals will call us to have that hospice conversation with the patient and family.
Okay. So is hospice covered under the insurance?
It is. Primarily, it's paid for through a patient's Medicare, if they're Medicare eligible. If they don't have Medicare, it's also paid for through Medicaid, and it's also paid for through private insurance. So if they have like a Blue Cross policy or HAP policy and under their private insurance.
Okay. And the concern of knowing that, you have a terminal illness, sometimes strikes a chord with the patient and says, well, I'm not going to be here very long. So they kind of like preparing themselves in a sense. But Cheryl, let me ask you this. So when does a patient or a family, should they consider hospice care?
It's a great question, Marcia. When the patient themselves do not want to go to the ER anymore, they're just tired, or let's say they have a cancer diagnosis and the doctor is treating them with some, great medication to hopefully help with those cancer symptoms, and they're getting very sick or they're getting other symptoms from that medication, and they just don't want to do it anymore. So that's when they want to come to hospice. Any patient, prospective patient, I should say, if there's a change in their cognitive function, their nutrition, they're having a hard time swallowing, they just don't want to eat anymore, and they're not able to ambulate, those are all symptoms of decline, and they could be ready for hospice. Typically, a doctor will talk to the family and the patient and say, you have a diagnosis and 6 months or less. The doctor usually is pretty forthright in coming, but sometimes families kind of suspect their loved one is making these changes and they're not getting any better. Mm-hmm. And so that's where we always can come out and evaluate to see if the patient is eligible for the for that hospice benefit.
Okay. But when the family is contacted, by you guys, and they say, well, hey, I don't know which one is which, they want to have a conversation with you to find out which service is better or which service will benefit their loved one. Do you have to, or do you find yourself often explaining the difference between hospice and palliative so they can be ready?
Well, I think initially we ask what are their goals, of care. And then that leads us in are they more in the, palliative, range for treatment, or more in the hospice, So we ask the patient, what do you want? Because we want them to feel in control as far as their own health and what they need from us. And I think just hearing from what they need, that kind of guides us, is it hospice or palliative care.
Okay, well, ladies, I tell you what, we're going to take a break, and we'll be right back with some more good information about hospice care. We'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
This isn't a workout video. It's about how LLS has helped blood cancer patients like me thrive, and how your donation can help countless others. Please give today at lls.org.
if you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
And welcome back to the show. If you're just not tuning in, we have residential hospice today in our cool place of seats here. And so what you want to know, ladies and gentlemen, is that there is someone at home that may be experiencing or in need of hospice care and have questions, want to know what the difference between hospice care and palliative. So we asked Stephanie Rose and Cherylann VanSickle to come join us today from Residential Hospice to give us some insight on what is the difference between the two and what services their organization provides. Now, if you have questions for these ladies, you know you can always give us a call, 1-800-323-5336, or email me at Marcia@JustAskTalkShow, and we'll get the questions right over to them. Now, ladies, this is very, no doubt everyone has experienced, if they haven't yet, will probably experience something dealing with hospice or palliative care. And I know in my home I have, and I'll just be honest, I was a little shooken up by it and everything. But definitely tell us a little bit of the services that you guys provide.
Sure. So all hospice companies do have certain services that they have to offer. So you have to have a nurse on staff, a social worker, a hospice social worker, spiritual care, and hospice aides. So that to be a hospice company, you have to have at least those services. One thing that's really nice about residential hospice, we also offer some other ancillary services. And we cannot bill through insurance for these services, but we see the benefits that our patients have from these services, and we provide that. One of these services is music therapy, and it's really nice for our patients that have dementia, because a lot of times they're nonverbal, and I've seen patients that were nonverbal, and then all of a sudden when the music therapist comes and starts playing the music, they start singing along. And I had one case where the husband hadn't heard anything from the wife in 2 weeks. And when they started playing the guitar, she started humming along. And I could just see the tears just rolling down his face because he hadn't heard his wife's voice in 2 weeks. We also offer massage therapy. And that's really nice for patients that have a lot of swelling in their extremities. So we're able to bring that swelling down through massage. And we provide that twice a month for an hour. And we find out what our patients like as far as different scents, and we make up their own scent that's customized for them for the massage. We also have aromatherapy, and that's really nice for patients that may have wounds. Sometimes wounds tend to have some odor to them, and we also make up a customized scent for them, and we actually spray their room twice a month. And we spray the room with that scent that they may like, just a nice fragrance. Because that a lot of times they get kind of embarrassed with that odor and just the dignity, so that's nice that we provide that for our patients also.
Okay. Okay, let me ask you this. So the family involvement, how deep is the family involvement? Should it be, or is it?
Yeah, the family gets very involved. A lot of times they're not used to taking care of their loved one at home. So our staff will do a lot of training with them. They've never really had to bathe their loved one. They've never really had to take care of their loved one on that level. So we help them. A lot of times our patients may have difficulty swallowing. So we instruct them on what to give their loved one so they don't run the risk of choking and things like that. Sometimes when a patient's asking for water, you think, oh, everyone can have water, but sometimes patients can choke on those things. So, you may need something to thicken that up. So we educate the families on how to care for their loved ones at home.
Okay, that's good. I mean, because a lot of people are, nervous about, well, dad's in hospice right now, and mom's just a wreck, and we don't know what to do. So it's like, do you come in and educate the family as a support mechanism to prepare them that when you go home, this is what you can do to make your loved one continue to be comfortable. Okay. And
the one thing that's nice too, our spiritual care and social work is also there for the patient, but also there for the family. Because a lot of times, I've noticed that sometimes people don't want to talk to each other because you don't want to put your burden and your pain on your loved one. And sometimes you're feeling it, you get sad and you're hurt, and because you have a loved one going through this. So it's nice to have a social worker you can speak to, or a spiritual care, and be able to kind of express those feelings.
Okay. So what's the difference between your organization, Residential Hospice Care, and your competitors?
We have a couple of differentiators. One of them is we are a level 5. We honor the VETS program, and there's 5 levels. So the Troy Hospice is at a level 5. We're going to be putting on an event, and there will be 80 vets there. For every vet that comes onto hospice, we do a pinning ceremony and a certificate. So we have our musician and our chaplain, and they usually will get their family there. So it's really honoring them for what they did for our country. So that's one of the things. If our start of care, we are so immediate and ready. If we get a hospice referral, a lot of times they'll want somebody out within a few hours because that loved one is in a lot of pain. We are armed with our start of care nurse with also a comfort pack. We can get them comfortable very quickly. Plus, I have to really say, we offer services, all hospices have to offer the chaplain, social worker, nurse, and home health aide, but we really have some of the most compassionate people. And the letters that we receive because of the care that is given. And it goes, I'm just going to touch on what Stephanie had said, but the education to the family, turning the patient, pulling them up in bed, feeding, the diet, even transferring them from a wheelchair back to a hospital bed. Those are all important things, and a lot of our families, they've never had any training in the medical field. And so it could be daunting, and that's where our team really comes in to support them with that.
That's great. That's great. Because I know when you first find out that your loved one is going into hospice, you just use the expression freak out, like what?
Right, right.
The whole house is turned upside down with who does what, when do you do this, how do you do this, and so now Stephanie, is it you or is it Cheryl that goes out to the home first, or is it a social worker?
Okay, so consents, we have to have consent signed. So that could be the start of care nurse or somebody in Stephanie's role that will give that informational and talk about hospice and then have them sign the consents. Once those consents are signed, then that patient is admitted. So that's a start of care nurse, or even our case managers will do the start of cares. And we're 24/7. People don't get admitted just during the day. We have staff available during the night. We've gotten calls from the hospital where a patient really needs us, and we're able to send somebody out there, to take care of those needs.
Okay. Well, that's nice. I mean, 24-hour care. A person's being discharged from the hospital, coming home, family members uncertain about what to do, and they get that call or make that call to you guys and say, can someone come out to the house? That's great. That's great. Well, I'll tell you what, we're going to take a break and come back with some more good information about residential hospice care. We'll be right back.
I try to keep up with what these young people is doing and knowing.
I was at work and I just got a text from a number that I didn't know.
I sent him a text. He texts me back and say, "Who dis?" And I just thought that was the funniest thing.
The next few weeks, she just made fun of me, like would answer the door and say, "Who dis?"
Who dis?
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
And welcome back to the show. Now, ladies and gentlemen, you know who I am, Marsha Florence. Now, I always tell you, there's always food for thought when you watch the Just Ask Talk Show. So today, we were sharing with you a lot of information about residential hospice care. And, a lot of you are concerned about how is it that, okay, you go from feeling good one day and then all of a sudden the doctor says, we're going to hospice. No, there's 3 levels. There's more than one level of just hospice and palliative care. So, Cheryl, I had to say that because people think that when you say hospice, you automatically going into their deathbed, and I don't want anyone to feel like that. Is there another portion to you guys besides these two?
Yes. So residential, we have hospice, we have palliative, and we have home care. And so if somebody is working on strengthening and getting better, that's where we're part of a continuum. That's where our residential home care comes into play. And then sometimes they're not quite ready for hospice, but they do want a nurse practitioner and they still want to have a little bit of aggressive therapy, but they still are declining, and that's where palliative comes in. And then the last leg of the continuum is the hospice part, and that's when a patient has a terminal diagnosis of 6 months or less.
Now, how does one know that they can get the continuous care? I mean, people just automatically think when you hear the word hospice, this is it. So how do you know, especially with your own agency, that part exists?
Well, we work very closely with the other 2 departments, and we have conversations. We do informationals with the patient and the family, but they don't have to seek us out. We really transfer them to the right level of care, really what their needs are and what their goals of care are.
Okay. All right. So I have some brochures here that I wanted to bring up for our viewers. So residential hospice specialty service. So can someone fill me in and tell me what would a person get if they ask for this in the mail?
Yeah, so that would be just telling you about the ancillary services that we have of the music therapy, the massage therapy, and the aromatherapy. So it gives you some details as far as those services with residential.
Okay. Excuse me. And then we have residential hospice experts in compassionate care and attentive support.
Yes, so that brochure basically tells you about the basic hospice services that we have as far as having the nurse, the aide, spiritual care, and social work. So it goes into detail about that so you know what to expect.
Okay. And last but not least, the Comfort Path, disease management with a focus on quality of life.
Yes, so that's our palliative program. That's that patient that still wants to seek some aggressive treatment and wants their symptoms managed, and that's the Comfort Path program with residential.
Okay. All right, and I think everybody should be educated, early on when they know that they have a terminal condition that may lead down the line for hospice care or palliative care, or what's the other one, continuous care?
We call it the continuum. So there's home care, palliative, and hospice.
Okay. And so actually, if a person gets the chance to meet with your staff to talk about this, they may know that down the line that they may be transitioning. So your agency can do all those things, correct?
Yes.
Okay, all right. I mean, really, this is heartfelt for me because I've been through it already, and I was in denial, like anyone else, trying to figure out what to do and what not to do. And so I really thank you ladies for educating me as well as, our viewers, because a lot of us are confused, not so much confused, but are afraid of what we're about to, encounter and everything. So I did want to say one thing before we close. Did you have any comments you want to make? Because really, I'm just impressed to have you here to share your knowledge. So is there anything else you want to tell us, Stephanie?
Well, I think a lot of times, like you said, there is a lot of fear, and I think to have a team that's going to give you that support, I think so often people need that you're not alone, that you have a full team behind you going through what you're going through with your loved one. And we also give bereavement support to families 13 months after the patient passes. And so often that's very important because, when the patient's passed away, it tends to get a little quiet, and we reach out to the loved ones to see, how are you feeling? When the birthdays come around, when the holidays come around, and just to reach out and say that we're still with you. We're still here to support you with whatever you need.
Great. Any comments from you, Cheryl, before we close?
Another item that we do, want to make sure we touch base, is volunteer. We have volunteers that also will come into the house. And the nice part is they'll be maybe playing cards or doing crossword or doing puzzles with a patient. It really depends on what their cognitive function is, but it allows that family member, maybe they need to run to the store and get some groceries. It gives them a couple hours to have that support right there in the home.
That's great. Well, we want to close with some video footage of one of you guys' residents.
Yes. So we had a patient, and this patient was right here in Michigan. Her name is Jackie, and it's really giving the audience a perspective on her life. So it's called Jackie's Story, and it's a beautiful story about her experience in hospice.
Okay, all right, well, thank you. And thank you, ladies, so much for coming. So, as usual, I always ask my guests, will you come back and join me again?
Oh, thank you for having us. Yes, definitely.
Absolutely.
All right. Well, ladies and gentlemen, we're going to close with Jackie's story. But before I go, you know who I am. I'm your host, Marsha Florence with Just Ask. And I always tell you, give us a call, 1-800-323-5336. Or email me, Marsha at Just Ask Talk Show. And if you have a question for these lovely ladies, Cheryl or Stephanie, you can always give us a call and we'll get the message over to them, okay? So we thank Residential Hospice Care for joining us today. And we're going to close with Jackie's story. I'm your host, Marsha Florence, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask Just Ask. I'm your host. Thank you.
My name is Jackie McKeeman. I have 4 wonderful grandchildren. My home was always open to everybody.
Is it good?
I love to make people laugh. I want you to get lines like these, like I have. Those are smile lines.
My mom is 74 years old and
about 3 months ago, she was diagnosed with stage 4 lung cancer. She made it her personal choice. She wasn't doing any treatment. When people hear the word hospice, they immediately think dying. I always thought, oh, it's a nurse that comes in and gives you morphine and sets you up on oxygen and makes you comfortable. I didn't know there was a whole other facet of hospice and how wonderful it was. It's about living your life to the fullest. It's about having a musician sing you songs. It's about having a therapy dog come bring you joy.
I have a dog. Her name is Sunshine that comes once a week. She just gives me my life.
I knew that this was the best decision that we could do at this point in my mom's life. She made herself a bucket list and we're sticking to it. We're doing things that I never thought in a million years we'd be doing, but I said, Mom, this is the year of the Jackie. Let's do it. It's been nothing but living and doing and capturing all the moments every day.
I detest, after you die, all the family and all the friends go to a restaurant and they throw this party. Well, I think that's the most silliest thing you've ever heard in your life. Have a party when you're alive.
My sister and I came up with the idea of having a sunshine party. We had it at my house.
I had about 50, 60 people. I wanted them to know before I died that I thanked them. And I had 5 little kids at the end sing to me personally, "You Are My Sunshine." Why? Because that was my song my daddy sang to me when I would dance on his toes.
I feel so fulfilled in having this family that's not blood, but knowing these other people are in my mom's lives. It's just phenomenal. It really is.
They make me feel that I have a life, that I'm just not an object that they gotta come in and be a caregiver for. They come in whether I look as terrible and I look like I'm half under. God, you look good today. And I can call them 24 hours a day. They're my friends. They're my family.
There's gonna be no regret. Absolutely, no regret.
I just want them to remember me as a loving and a happy person.